Okay. You're not on. No? Great. We had some wonderful food for thought, and we're still having food for thought. For the next bit of time here, we have about a while. I wanted to make sure we make use of this opportunity to talk to Dr. Eisler about some of the difficult issues we face in healthcare, some of the challenges we face, and how we might think of them or reconfigure them in a partnership way of thinking. A little bit about how I know Dr. Eisler. I was fortunate enough to have her as my professor as I was getting my PhD. And I had read her book, The Chalice and the Blade, back in 1987, and it was transformative for me. And so when I went to my graduate school, I did not realize she was there. And they said, well, one of the people who was going to be presenting on your first day of orientation is Dr. Eisler. And I was like, oh my gosh. I was thrilled. And not only was I thrilled, but I was thrilled to hear more about her recent work and where she has continued to go with her recent work. And that empowered me to apply Riane Eisler's theory, cultural transformation theory, to the history of nursing. And I, in my dissertation, rewrote the history of nursing, taking it back to the original healers, and what have we lost because we have allowed other people to craft our story and shape what our personal identity is about. So I used the partnership theory to rewrite what nurses do and who we are and where we can go for the future. And I want to tell you that she doesn't just talk partnership, she lives partnership. My PhD experience was fabulous. It was not a dominator experience at all. It was very much a partnership experience where she gave wonderful advice, wonderful support, and I exited my educational experience being in love with my topic, being impassioned, and continuing to have professional joy. So I think we need to look as educators, do we oppress or do we lift up? That's something we need to keep on our radar as well. Part of the themes yesterday was the people who are involved in professional joy continue to be stimulated. I had a wonderful opportunity last night to have a dinner with Riane, and I love this type of thinking because she's not thinking in one field, it's this broad thinking. First, she became an expert historian, expert social scientist, an expert economist, and now she's moving into the field of neuroscience and really digging deeply into that field. There's nothing that says nurses can't do the exact same thing. We too can explore different fields that empower and inform our work and lead us to become the leaders we can be in redesigning healthcare in America. So now I'd like to open it up to questions you have for Dr. Eisler. Can I close this? Yes.
Eisler?
Hi. Oops.
Oh, Dr. Eisler.
Oh, there, in the corner.
Sorry. First of all, I want to say thank you so much. I loved the dialogue. I thought it was excellent. Overall, it was very empowering and gave me really an opportunity to reflect on the work that I do and the good work that you've done in seeing the parallels that we both share. With that said, I also want to thank you for your honest approach to economics and your talk related to Adam Smith and the visible and invisible hand being the government and the invisible hand of the economic forces underneath. Also with Marx and his feelings towards equality. Second, I want to bring, I had an opportunity to talk to you during the break, and one of your colleagues, Dr. Vandela Shiva, a quote from her that I think also speaks loudly in the way that you did. That you are not Atlas carrying the world on your shoulder. It is good to remember that the planet is carrying you. So I thought that was, that was something that I wanted to bring to the group. And then also, I wanted to ask a question of you. So the World Bank being a very powerful organization, what's your feelings on how you see the role of the World Bank and their position in the global embracement of care, corruption, and positivity. Looking at the World Bank, they utilize a lot of the funds that they have to build dams. So can we utilize that as a metaphor for what they're trying to do as, within our social movement?
Well, am I on? I don't. Oh, good. There's a wonderful organization which is a member of our coalition called Gender Action. And their work is very specific. The president of it, Elaine Zuckerman, is a woman who was with the World Bank, and they watch their real policies concerning gender and care. And while they have recently in the World Bank actually done an excellent research study on the importance of gender economically, in fact, in their allocations of, it's for dams, it's for big roads, it's for all the things that really do not empower the people on the ground in any significant way. And we have to really accept that that's how it is, but it doesn't have to be that way. So I urge you specifically to look at Gender Action. I think it will be very, very useful to you because, as I said, really this gender issue is key to so much, including what is or is not given economic priority. I think there was somebody on this side, yes.
Hi, thank you for coming to speak with us today. I wondered, I know that you are asking us to take a look at some of the paradigms behind the decisions that we may not have thought about before, and you talked about how hierarchies are not necessarily always negative, especially if you have something different than the domination hierarchy where you have respect going both ways. And what I have seen in my experience is that often there's an assumption that those that are working under you will give them an inch, they'll take a mile, that they are inherently lazy. There is an assumption about human nature so that you can't give flex time, you can't listen to what they need or give them any sort of flexibility around in their workplace. And I wonder if you could speak to that in relation to that kind of paradigm view that we need to have.
Well, as you said, it's a paradigm, isn't it? And you know, in people who are really stuck in the domination systems paradigm, there are really only two possibilities, are there? You either dominate or you're dominated. There is no partnership alternative. Now, people come by this honestly very often, as I said, through their early experiences, through what they experience particularly and observe in their families, in gender relations, in their own parent-child relations. So, yeah, I mean, from that perspective, people always say that there's a trust deficit, but you really can't trust in a domination system, can you? I mean, those on the bottom don't have any much reason to trust, and those on the top know that there's a volcano under them, right? About to erupt, give them a chance, so they're afraid that it's going to erupt. And you're really putting your finger on that. So part of our job, and I, in my work, have found that that's why I spoke so much about how economically successful in business as well as in national policy, the partnership paradigm and caring policies and practices are. And I think that's a good entry point. And you will always find that there are some people who are really hermetically sealed. And I would not really waste my time. But you will also find that you can find allies. And this is really very important, and this is why in the Caring Economy campaign, we really are building coalitions. And why I have invited you to get your organizations just to sign up. It's free. You just go on the website, caringeconomy.org, and sign up your organization, because eventually in that website, we will feature the related work of the various organizations. And that way, we can really continue to do what we're doing but also focus. Focus on the underlying issue, which is what are the priorities and what are the assumptions. And using our power and influence to change them. And that, yeah, that power isn't a bad word. It depends on the context. Is it power over only? That's not so good. Is it power to and with? Then we can really use it creatively. Does that? Good, thank you. All right, there's people, yes.
Thank you for sharing this morning. It was very enlightening and very encouraging. I have a question. Earlier, before you spoke, we were talking about value groups, and it seemed like wealth and fame and fortune and things like that were on the least important end for nurses. And so when we talk about bringing together economics and caring, an example you gave with the stockholders, you know, that they, or stockbrokers, I should say, the stockbrokers, that they get paid more, but it seems like that's probably a bigger focus for them. So how do we, you know, bring together caring and economics when it doesn't seem like it's a priority for us?
Well, the issue I have found really is not so much bad people, quote unquote, but bad rules of the game. And that's why we're starting with measurements. Because if we really continue in this short-sighted way of only measuring national economic success in terms of GDP, which is what, you know, the stockbrokers, you know, market goes up, you know, with GDP, but, you know, so does unemployment, so do foreclosures, so does hunger, poverty, right? So it's a lousy measure, as I mentioned. So we really need to, this is why we're working on social wealth indicators. But, you know, on the ground, right, what can you do? You can do a lot. You can really change the conversation, because that's the first step in changing the way that you look at what is and is not valuable. And I think the entry point, like with a stockbroker, okay? I mean, not that that's particularly the person. I mean, they're into speculation, because that's what it's a casino, isn't it? I mean, the stock market. And it, too, as you saw in that video, doesn't really reflect what's going on in real terms. But if you want business people and policymakers to take caring economy seriously, you start with what I emphasize, show them that it will benefit them, but also show them that as we now move into the post-industrial knowledge service economy, and this is basic, where economists never tire of telling us that the most important capital is what they like to call high-quality human capital, right? That it is potentially economically disastrous in the very terms that they like to use, you know, US global competitiveness, to continue with the kinds of policies that we have, which is to not invest in caring for people, because we know human capacity development, first of all, it starts in childhood, right? Whether it does or does not happen, hugely influenced by the quality of care and education children receive. So in the social wealth indicators, the meeting that we had in Washington, D.C., as I said, attended by the director of the Bureau of Economic Analysis from the federal government, who's very hampered politically, by the way, in what he may or may not measure. I mean, he came to our meeting because he really wants to, I mean, they do so-called satellite reports. I should really tell you about that, because people may say to you, how can you measure the economic value of the working household, right? And they're going to say, you know, well, you really can't completely measure it, because how can you measure, you know, that joy, right? From being cared for and caring and the empowerment and, you know, all of that. But you can measure it in some very specific ways. For example, the Swiss. And I always like to mention the Swiss because they're not exactly the most radical nation on the planet, right? And they're a very successful nation. They did a study that's in one of their satellite reports, and they showed that if the value of the unpaid household work, which is to a very large extent, as they pointed out, that unpaid, quote, women's work, whether done by a woman or a man, of caring for people, children, healthcare, etc. If that were included in the reported Swiss GDP, it would be 40% of the reported Swiss GDP. Now that's huge, but it's not part of the conversation. So those of you who teach, for example, get these materials, put them in your classes, whether it's in a university or whether it's in a program. Talk about women, men, and the global quality of life. And by the way, you can download that, or you can order the complete report from the Center for Partnership Studies at partnershipway.org. People need to know this. They need to have this information, which is not part of the canon yet. Because whether it is or isn't is up to us, isn't it? So that's sort of a long-winded way of saying that there are specific actions that you can take. Thank you. Yes?
Tricia Young from Minnesota State Mankato. I'm a nursing faculty member. And we don't really have a question, but just something to share with the group. We were struck by the very simple but profound idea of just changing the language that we use, moving toward partnerships. And so I want to turn the mic over to my colleague Cheryl here, who shared the very small act that got our table excited.
Hello, I'm Cheryl Lane. I'm a nurse manager at Regents Hospital. And we started a program called Nursing Out Loud. It was developed by a colleague of mine and has spread to other nursing units, where we changed the language that we use when nurses go in and introduce themselves to their patients. And rather than saying, "Hi, I'm Cheryl, I'm your nurse," we changed it to, "Hi, I'm Cheryl, I'm your professional nurse." And it opened the conversation for us as nursing to share with patients what our body of knowledge is. Excuse me, because patients have a misconception that nurses work for physicians, and we wanted to share that we have our own educational knowledge. I'm a little nervous, sorry. The second thing is that changing the wording, rather than when patients say something, rather than saying, "I'll check with the physician," or "I'll ask the physician," we say, "We'll collaborate with them during our interdisciplinary rounds, and we'll get back to you with a response." So it is subtle changes, but really profound in when you change some of the words that you use, the meaning totally changes and allows you to have the conversation.
I love your partnership language. I love it. And that's really a great example, isn't it, of how you can change the meaning of relationships, the meaning of a profession, the meaning of work that's done. And I think it's really very important. And I'm heartened by what I hear, that there's a movement now towards this interprofessional teamwork. But you got to be a little careful, because you can have, as I said, collaborations where there are still hierarchies of domination, right? And that are still in the domination system. So the kind of thing that you're talking about is very, very important, and thank you. I did want to say something, because so many people asked me about the video, and you can download that for free from the website, from caringeconomy.org. And I think it's really a good teaching tool. And there are a lot of resources, both on that website and also at partnershipway.org, which is the mother organization of the Caring Economy campaign. And I also wanted to say something else that people asked me, because they ran out of books. They didn't order enough books, apparently. And so if you want a signed book, I mean, you can get it. You can get these books. They're on Kindle, they're on Amazon, But if you want a signed book, you can also get it by emailing the Center for Partnership Studies at center@partnershipway.org, and just say, "I was at the nursing conference and I'd like a signed book," and you will get one, okay? And you can pay through PayPal or whatever it is, So anyway, but those were two announcements I was asked to make. Was there something else that I was supposed to announce?
Got some other questions.
Oh, okay.
similar going on at our table as far as language goes, and it was about using first names and a place where physicians and nurses were all using first names with each other rather than having the hierarchical titles right there in the middle of everything. And that also led to a little discussion about two different units that one of us has worked on, where there were the first names in the one unit and the other ones were using full titles and last names. And I asked a question about how much time each of these different kinds of physicians were spending with patients. And the idea being, if they were on a first name basis, would they ask more questions? And of course she said yes, that there was more time spent with the patient. However, we are in a domination society where that's not rewarded. The opposite is rewarded. The more productivity rather than the quality of the relationship is what's rewarded.
Well, and this again takes us back to how do we measure productivity? I mean, seriously, because I mean, if you measure productivity in terms of how long you can keep this poor person who wants to die alive with all of these terribly expensive and horrific things. I mean, you know, we all, at my age, we all pray for a quick and sudden death, right? And we have all of these instruments saying, for goodness sakes, I mean, I think we should be allowed to really go to a physician, as we can now in the state of Washington, and say, please help me, I want to die. And not have that be against the law. But how do you really measure productivity right there? And what are the costs, for example, to a patient and to society when you really don't spend the time? I mean, they're huge, aren't they? So that's why we're working so hard on these social wealth indicators as a way of changing the perception of what is, as you said, quote, productive. Yes, please.
One last question. And you began to touch on it as you were just finishing, so that's really good. It dovetails well together. When I hear people talking about social wealth indicators, I think it's a really great concept, but I wonder, do we need to have something in place for the risk of some people being considered more valuable than other people? Because I mean, we even do that when we look into solid organ donations, and then being a black woman, I do have concerns, you know, that certain people also being raised in the inner city of Chicago, you know, are poor people worth less than people who make more money? You know, our different races worth more. So, you know, just always have a concern when we're changing the language that we have those safeguards. And, you know, just wondering, you know, do you think we need to have those in place?
Absolutely. And when we are talking about social wealth indicators, we want to be sure that they are unpacked in terms of, look, because the problem is this, that even the new indicators coming down the way, because, you know, like the Stiglitz-Sarkozy and so on that you've perhaps read about, they still marginalize women, children, and yes, disempowered populations based on race, ethnicity, etc. So every one of these indicators will be unpacked in, you know, by gender, by race, so that we really have the data, which we don't, by the way, if it isn't really unpacked. Okay, and that's very, very vital. But this is, I'm glad you brought that up, because most of the work that's being done on new indicators is on taking into account the environmental costs, those so-called externalities, which are, of course, horrendously costly, right? You know, I mean, and not to speak of what a threat they are to survival, okay? And that's important, but they still fail to pay adequate attention to the majority, really, which is women, children, and I mean, in the United States, for example, populations of color are on the way to being the majority, for goodness sakes, and yet we still think of them as a minority. So it's time, you know, that we really have a different approach. So thank you for bringing that up. And there was somebody over here who didn't have a mic.
Someone with a mic right here.
Yes.
One thing that really resonated with me is how you spoke about daycare as a federal issue, as a government issue, and one thing I think that we as hospital employees might start to establish and create something where the government goes, hey, that's working for those hospitals, is where we as employees demand that our children are being watched by people we hire and we want working in our hospital. And that was just something that really resonated with me, and I wanted to thank you for making these huge issues where we're being attacked on every front. If you can single out something small as daycare.
No, I think it's very important what you bring up. As I said, none of us can do everything, but all of us can do something. And this issue of high quality daycare, of high quality early childhood education, study after study has shown how this really is economically, never mind, in terms of the human cost. Well, first of all, of course, you avoid so much of the stress. For the professions where there is more of the norm of having child care, or the companies, people are less stressed. It's just that simple. But it's not only that, it's the benefits to the children and the parents and the societies. And because we'd rather pay the back end costs now, right? Let's have a prison instead of investing in caring for a child. That's insane. But see, if we don't really look at what I call this gendered system of values, because, what's a prison? It's control, right? It's what the punitive head of household is supposed to do, right? Or the punitive sovereign, or whatever it is. So let's show people that there's a better alternative, because you can't just deconstruct. You have to reconstruct. And I so agree with you. Show how it really works. And start with where you are. But do both. Because I have to tell you something. I find, talking about joy, there is so much joy in doing this bigger work, in joining with others who do it. And it is very empowering to us also then to do something on our local level. You see what I'm saying? So it's not an either or, it's a both and. And that's why we have the Caring Economy campaign. Yes, there's somebody over here, yes.
I want to thank you so much for I thank you so much for just a fascinating talk this morning, and I think for giving us that thought about quite a simple concept of dominance versus partnership. And as I sat here at the table and we talked in our small group, in some ways it so crystallizes for me many of the problems within the healthcare system today. I think of in terms of, your conversation, someone brought up interprofessional collaboration. And when I think about that, though, I think about that's not where our dollars flow. Even in medicine, there's a dominance of the specialists being valued more than the primary care provider. So the money, we pay more to do more in a specialty way. Public health continues to be underfunded, defunded, and has the power to do so much more for our society than putting lots of dollars into rescue care. I see my colleague here, Dr. Sheila Rigg, who's a dentist, and I know primary care dentistry is near and dear to her heart. And I think about how we pay so little for Medicaid for dentistry in our state and across the country, that oral health needs are a disgrace in our country. Children and adults with mouths that's painful to eat, they can't function. One of the biggest causes for loss of time in school is abscessed teeth and toothache.
Oh, I didn't know that.
So, you think about it, and you think about how the hierarchy is, and then as an advanced practice, and you all knew I couldn't get up and not talk about advanced practice nursing. As we talk as a healthcare community here at the university, the Academic Health Center, we're working very hard towards this idea of interprofessional education, of true collaboration. And it seems to me today that what we really need to do first is talk about the partnership versus dominant kind of framework. Because recently, again, there have been papers published by organized medicine, I would say, medical professions saying we embrace team care as long as we get to be the leader of the team. Whereas I think many of us in a partnership model would say that, that the leader of the team should be whoever is most aligned with the needs of the patient at that given time. And I would argue that many times it might be the dentist, or it might be the advanced practice nurse, or it might be the social worker. If it's someone who really has issues with social determinants of health, that's their big health issue. So I just think it gives us I just thank you for helping us see that there is a framework to look at all of this. And I think if we're really going to move down to true interprofessional teamwork, collaboration, education, I think we all need to sit and have the hard conversations around that partnership dominance theory first. So I thank you for that.
Well, thank you. And I want to say really that the power of partnership is a fabulous tool for doing that. As Teddy, I think, will attest, but I also want to say that Teddy has a vision. I'd like you to talk about that, about the importance of research and of interdisciplinary research to precisely have the evidence base for what we've been talking about, that really more caring and more partnership-oriented, because the two go together, approaches are not only better for people, better for the environment, but that they are more economically effective. If you do think of economics, by the way, not, like a grazing animal, which is ridiculous. Right now, you've got to think of the longer term. And in the longer term, there's just no question, right? So again, we're talking about changing the perspective, changing the conversation. But Teddy, where are you?
Thank you.
Go ahead, darling.
One of my favorite quotes is an Ethiopian proverb, and the Ethiopian proverb goes like this: "Spider webs united can tie up a lion." In that it's so easy to feel, who am I? What difference can I make? I feel perhaps my link, my piece of the web is not strong enough. But united, we can tie up the biggest beasts in our society. And so I really do think, agree with Mary. I told Dr. Eisler last night at dinner, I said, be prepared for an advanced practice question. Because it's so right on. Because it's so right on. In that if we don't change our language and our story and our model, it's only going to be new clothes on an old person. It's the old thing repeating itself. So we'll say, shoot, we redesigned healthcare and we're getting the same outcomes. We have to restructure how we relate with one another and not be afraid of one another, but to uplift one another and say, this is totally the setting that you call in the dentist, totally the setting that you have the advanced practice nurse be in partnership with the patient to come up with the best plan of care. This is an acute emergent situation. This is totally the best time for the skilled practitioner physician to enter in with the medical knowledge. And to not be feeling is in a dominator system where one diminishes the other. If somebody else is in charge, that means I'm less. No, it isn't. In a partnership culture, everybody doing their work, be it tackling racism, being it working in changing language of the nursing units, working at policy levels, working in designing new models, this work is tying up the lion, but only if we do it together. If we're off this single strand doing this and this single strand, it won't make it. So I was planting seeds last night at dinner that the University of Minnesota has everything here to become the web that ties up the lion. We have the Hewitt Humphrey Center for Public Policy. We have the Carlson School of Management. We have the School of Nursing, the School of Dentistry, the School of Medicine. We have all of the things, wonderful things going on in the Academic Health Center. With the social workers, the people doing design theory through the design programs. It is all here. Now we just need to talk. Now we need to do research that's transdisciplinary research that moves this system forward. So I wasn't expecting to do that, but there you go.
And I have to say, I love Teddy's vision of partnership studies, because that's what you're really talking about, Mary, isn't it? I mean, if you don't really start making that the frame and the shift from a domination system to a partnership, because we honestly came by the domination system, we inherited this, through much of history. And as I said to you, all the progressive social movements have challenged, and this is why I hope that there can be more focus really on the primary human relations, parent-child and gender relations, because it is on that foundations that the domination pyramid keeps rebuilding itself, doesn't it? Through regression after regression, whether it's in the east or west or north or south. And so if we can have this integrated approach, then we have really a foundation. So I hope that you will do this. I'm really looking forward to it.
Hi, I'm Gigi Kaderi from United Health Group. I just wanted to share what our group discussed earlier. One of the things is, well, thank you for changing our perspective, or at least giving us another perspective of looking at healthcare. We were discussing the domination between a provider, whether it's a doctor or a facility, and the patient, where the patient is the dominee and the doctor is the dominator, or the facility. There was a patient who came to see her doctor for an annual visit, and the doctor asked her a question about her back, which she was having back issues. And then when she got the bill, she found that the doctor had upcoded the visit, and she had to pay more because now she was going to have more health issues, and it wasn't anymore an annual visit, which is supposed to be free. And then we have doctors who want to be paid upfront for a visit, even though there's still some health insurance issues that need to be worked out, and you feel helpless having to pay for care up front when you know that that there's a health insurance contract that you signed where you're not supposed to be paying up front, but the doctor dominates again in that, or at least the billing office dominates again in that perspective. So those are some of the things that we talked about and I never envisioned that before. I never had that perspective before until you talked about it. And the other thing I wanted to ask is if you've heard of the gross national happiness in Bhutan, and I wanted to ask you if you could speak to that and its relation to the concept of caring economy.
All right, I'm glad you asked. Well, first of all, thank you for sharing all of these ways in which really the system is gamed. And let's face it, that has a lot to do with the values, doesn't it? With what is considered important or not important. I mean, well, anyway, but about the Bhutan National Happiness Index, I have a problem with it, and this is that happiness is a very subjective issue. I mean, you can ask a woman, well, as I said, in Nairobi, for example, the women from Iran, who are really, they were being shepherded in their little veiled costumes with the black, by these guys, saying, we're happy. Everything is wonderful for women in Iran. Whereas the women from the Nordic countries were complaining like crazy. So if you really use a happiness index, you would have to conclude that things are much better in Iran than in Sweden. That's not a good thing. So I like to have more empirical measures, like what is our investment in early childhood education? How are we measuring the economic value of the work of caring for people in households. What are the outcomes that we want? I mean, listen, the thing behind the social wealth indicators, and it's a developing project, obviously, is what are the drivers in a society that will ensure that the human capacities of every individual can be developed. I mean, it's an ideal, isn't it? But as I said, it's a very important economic ideal in the post-industrial knowledge service economy in strictly economic terms. And of course, in human terms, it's huge. So we are really looking at it from a question of what is really empirically measurable. And I find that asking people if you're satisfied or if you're happy is not the best measure. Because people are brainwashed, aren't they? By domination systems to, quote, accept their subordinate place. I mean, like this whole idea of trickle-down economics, which is really dominator economics, isn't it? I mean, it's a return to this notion, because that's the point that I make. It isn't capitalism. I mean, it goes way back to this notion that people at the bottom should content themselves with the scraps, right? Dropping from the opulent tables of those on top. It's really a nauseating concept. But we've been taught to believe that somehow that's the way to a better society. How they did that is really a masterpiece of propaganda. I mean, just amazing. Just amazing. But we can be just as good at it. We know. We know how to do things. You know how to do things. And I really want to close by saying that for me, personally, it is a joy to be with a group like yours, to hear the reports that you have from your various groups, to see how you are thinking of applying this framework, which is an empowering framework.